Namaste and welcome to all viewers of ANCN channel ITRA Jamnagar. I myself Dr. Rita Khagram, working as an associate professor in Panchakarma department ITRA Jamnagar. In this academic lecture series, I will discuss the principles and practice of Swedan therapy with integration with the thermotherapy. Swedan is an important Ayurvedic procedure used both as a preparatory therapy and as an independent treatment procedure. In this lecture, I will connect the Ayurvedic concept of Swedan therapy with the modern physiological understanding of heat therapy. The content of today's lectures are Panchakarma and Swedan, brief introduction of the Swedan, Swed as a Ayurvedic and modern perspective, sweat glands, sweat used as a diagnostic purpose, thermotherapy and scope of research in Swedan procedure, and at last conclusion. First, to understand the Swedan procedure, we should place it within the Panchakarma. Panchakarma, it is considered the unique and wonderful treatment modality in Ayurveda. But prior to administration of Panchakarma, some procedures are to be done mandatory, known as the Purvakarma. Swedan belongs to mainly in Purvakarma along with Dipan, Pachan and Snehan. Its purpose is to prepare the body before the main purification procedure, and its preparation makes this procedure easy and effective and successful. In terms of Panchakarma, Swedan is an important and essential Purvakarma performed after Snehan and before Panchakarma. For example, before Vaman and Virachan, Sarvang Swedan is carried out, while before Basti, Nasya and Rakta Mokshan, Sthanik or Sarvang Swedan is carried out. Without this step, the main procedure, that is Panchakarma, might be incomplete or even be harmful. But Swedan Karma is not only a preparatory procedure. We can apply it as a Pradhan Karma in particularly Vat and Cough dominant disease. For example, we can administer the Swedan therapy as a main part of treatment in Urustambh, Amvat or whenever the Shul and Stambh Pradhan disease are there. We can apply this Swedan therapy as a Paschat Karma, for example, after the procedure of Nasya, after the removal of Mudgarb and after the normal delivery, to reduce the inflammation and to bring the body in its physiological state. In some conditions, we can apply the Swedan procedure as a Purva and as a Paschat in both the conditions, for example, in Arsha, Asmari and Pagandar. Now, let us understand what exactly the Swed is. Swed means sweat or perspiration. In Ayurveda, sweat is considered one among the three excretory metabolic products like urine and stool. Mal are important in human physiology. They are formed in routine physiological and metabolic activities in the body. But if these malas are accumulate in the body, they are able to vitiate the other dhatus and tissues. So, it is important to cleanse and purify the body by removing the excess mala. Swedan is important for removing waste formed in the skin and maintain the body temperature, that is thermoregulation. So, Swed is not just a waste product, it has a physiological importance too. Now, we will see the normal function of Sweda. While describing the malas, Acharya Charak has quoted that Malaha Swedastu Medasaha. That means Swed is a mal of Med Dhatu and its main functions are Kled Dharan, Tvak Sneh Dharan and Rom Dharan. That means it maintains the fluid balance in the body, it preserving the skin moisture and it supporting the hair follicles. In modern terms, this corresponding to regulation of body fluid and electrolytes. Now, coming to the definition of the Swedan. Swedan is defined as the process by which the sweat or perspiration is produced by various means of methods. Acharya Charak has quoted that Stambha Gaurav Shitagnam Swedanam Swed Karakam. That means the procedure which relieves the stiffness, heaviness and coldness of the body and produce sweating, it is termed as the Swedan. Now, in Ayurveda, regarding the importance of Sweda, it is said that Sweda sadhyaha prashamyati gadaha vata kaphatmakaha. That means Swedan therapy is indicated in Vatic condition, kapha dominant disease and the disease when the Vat and Kapha both the doshas are combined. Again, Acharya Charak has quoted that Sneha Purva Prayuktena Svedana Avajite Anile Purisha Mutra Retansi Na Sanjanti Kathamcha. That means another important point mentioned here that Swedan should be performed after the Snehan therapy. When sudation is properly administered after oleation, it helps to soften and mobilize the doshas, and because of this, the normal elimination of the feces, urine and semen becomes easier and these do not stagnate in the body. So, the practical message of this shloka is that Snehan followed by proper Swedan, it helps in relieving the Vata Kaphatmak disease and supports the normal movement of vitiated dosas and elimination of these dosas from the body by proper Panchakarma therapy. Now, again Acharya Charak has quoted that Sushkanihi api kashtani sneha sveda upapadanaihi namyanti yatha nyayam kim punarjivito narana. This shlok explain how important the Swedan procedure is in the Panchakarma, as by application of oil and then sudation therapy, the dry stick becomes soft and elastic. Then what will be its effect in the human being? So, first softened by the Snehan, then mobilization by the Swedan therapy and then elimination by the proper Panchakarma treatment. Again in Ashtang Hriday, it is quoted that Acharya Vagbhat has explained the role of Swedan after Snehan by saying that dosha which have been lubricated by oleation therapy, they are residing either in the alimentary canal and tissue or they are lurking in the channels of the extremities, bones, etc. So, Swedan is the next important step to liquefy the vitiated doshas and bring them into the alimentary canal for the elimination by applying the proper Panchakarma. Again, in Ashtang Hriday, Acharya Vagbhat has mentioned three important treatment modalities for Vata management. He said that Vatasya Upakram Sneha Sveda Sanshodhanam Mrudu. That means Snehan, Swedan and Mrudu Sanshodhan are the main treatment modality for Vatic disease. Here again also Swedan is one of the important treatment for Vata disease. Now coming to the composition of the sweat. From modern perspective, sweat is composed mostly of water, that means 99%, and in remaining 1% it contains some salts like NaCl, some metabolic waste like urea, ammonia and lactic acid. Sweat also contains dermicidin which act as a microbe killing protein. Sweat is a hypotonic solution which is having the pH in between 4 to 6 and it has a acidic nature. Now let us look at the major function of the sweating. The first and foremost important function of the sweating is thermoregulation. Sweating is regulated by the sympathetic division of the autonomic nervous system. When body temperature rises, sweat is produced and its evaporation helps in cooling the body. In this way, sweating helps maintain normal body temperature and prevents overheating. Another important function is excretion. Through sweat, the body removes small amount of substance such as urea, ammonia, lactate and salts. Thus, it protects the skin. It also maintains the skin hydration and acidic nature of the sweat inhibits bacterial growth. We also see emotional sweating during anxiety, fear and stress. Sweating may increase especially over palms and armpits. So, overall sweating is not only a cooling mechanism, but it also supports the excretion, skin protection and emotional response. To understand how Swedan works, first we look at the sweat glands. Sweat glands are a type of exocrine gland that produce and secrete substance onto the epithelial surface by way of duct. Sweat glands are tubular structure of the skin that produce a sweat, and the role of the sweat is regulating body temperature and elimination of the waste product. There are mainly three types of sweat glands: eccrine glands, apocrine glands and apoecrine glands. Among these three types, eccrine glands are our cooling system and they are found everywhere in the body, while apocrine glands are deeper and respond to emotional and hormonal trigger. Sudation therapy primarily activate eccrine system for systematic detoxification. Eccrine glands are distributed almost all over the body, but highest concentration is found on the palms and soles as they are important in grip and thermal response. Sweat glands are absent in few areas like lips and external ear canal. Now, let us see how the eccrine sweating is controlled. Eccrine sweating can be triggered by thermal stimulation, then mental or emotional stimulation and gustatory stimulation. All are mediated through sympathetic activations. Now, let us see how sympathetic sudomotor pathway works. When body temperature increase, it is sensed by peripheral thermoreceptor which are present in the skin and central thermoreceptor especially in the hypothalamus. These signals are then processed by the preoptic area of the hypothalamus which act as the thermoregulating centers. From the hypothalamus, signal descend to the intermediolateral cell column in the spinal cord at the T1 to L2 levels. Preganglionic fibers enters in a sympathetic ganglion such as paravertebral ganglion where they synapse with the postganglionic fibers. These postganglionic fibers finally reach to the sweat glands and stimulate them to produce the sweat. The evaporation of the sweat from the skin surface helps cool the body and maintain the normal body temperature. Here, postganglionic neurons release acetylcholine, not norepinephrine, and this is unusual as most sympathetic postganglionic fiber release norepinephrine, but sweat glands are the exception. Acetylcholine acts on muscarinic receptors on sweat glands to trigger sweat productions. Sweat is initially isotonic fluid. During passage through the ducts, sodium and chlorides are reabsorbed making it hypotonic. Sweat evaporates from the skin surface and it leads to heat loss and lowering the body temperature. Now, see, beside thermoregulation, sweat has diagnostic importance also. The sweat chloride test is a gold standard diagnostic test for cystic fibrosis, which measures the concentration of the chloride in the sweat. A useful clinical clue is that parents of a baby with cystic fibrosis often notice that the child tastes salty when it kissed. This is an early hallmark symptom. Sweating can also be altered in certain diseases. In peripheral neuropathy such as in diabetic neuropathy, the nerve supplying the sweat glands may be affected. So, sweating become reduced or altered. In Horner's syndrome, sweating may decrease on one side of the face because of disruption of the sympathetic pathway. On the other hand, in hyperhidrosis, there is excessive sweating due to overactivity of the sudomotor pathway. Now, coming to the thermotherapy. In modern physiology, Swedan can be correlated with thermotherapy because both use heat as a main therapeutic principle. Thermotherapy simply means the therapeutic application of heat to the body. Its main purpose is to relieve pain, improve circulation, increase soft tissue extensibility and promote healing during the rehabilitation. Now, heating modalities are broadly divided into two types, superficial heating and deep heating. Superficial heating include wax therapy, moist therapy and fluid therapy, while short wave diathermy, infrared radiation, UVR and laser. When heat is applied, it produces several physiological effects. It increases local blood flow, it relaxes muscles, improves tissue flexibility and helps metabolic activity in the affected area. So, from the modern point of view, the benefit described in Swedan can be understood through the hemodynamic, neuromuscular and metabolic changes produced by the heat. Now, let us see how heat produces this effect in the body. One of the first hemodynamic effect is vasodilatation or increased blood supply. Heat causes vasodilatation in local cutaneous blood vessels and result is in increase the blood flow to that particular area, which improves oxygen delivery and removal of metabolite waste. Now, let us understand how heat causes vasodilation. When external heat is applied to the body, it increases the skin temperature and this activates the cutaneous thermoreceptor present in the skin and send signal to the hypothalamus, which is the thermoregulatory center of the body. In this response, autonomic nervous system brings about two important changes. There is a decrease in sympathetic adrenergic vasoconstrictor tone and increase in sympathetic cholinergic activities. At the local tissue level, heat can cause the release of vasodilator substance such as nitric oxide, bradykinin, histamine, and among these three, nitric oxide plays a major role in relaxing the vascular smooth muscles, especially in the arterioles, which results in vasodilatation, and because of this vasodilatation, cutaneous blood flow increase significantly, which results in clinical effects like improved oxygen and nutrient delivery to the tissue, removal of metabolic waste, enhanced sweating and finally muscle relaxation occurs, which helps in reducing pain and stiffness. Now, let us discuss another important function of the heat therapy, that is increased metabolic rate. A basic principles behind this increased metabolic rate is explained by the Van Hoff equation, which state that when tissue temperature increase, the rate of chemical and enzymatic reactions in the body also increase. So, with this rise in temperature, cell activities increase, we can also get the cell motility improvement, cellular synthesis becomes more active and processes like tissue repair and cell growth are stimulated. Now, because of metabolism is accelerated, the tissue requires more energy. As a result, the demand for oxygen is also increased, the need for nutrients and food substance also increase, and at the same time there is an increased production of waste product and metabolites. Clinically, this increased metabolic activities helps in promoting tissue healing, accelerating repairing process, reducing stiffness and improving overall tissue health. Another important physiological effect of heat is accelerated or encouragement of the healing. Heating can accelerate healing by increasing the circulation, enzymatic activity rate, cell activity and availability of oxygen to the tissue. It is particularly useful in proliferating stage of the healing. Next function is increase the tissue extensibility. Heat increase extensibility of collagen tissues such as tendon, ligaments and joint capsule. That is why heat is often applied prior to physiotherapy before stretching, and it helps in improving the range of motion. Now, contraindications of the heat therapy. It should not be applied in some conditions like in acute injury or inflammation, in pregnant women, in impaired sensation and cardiac insufficiency patient. Heat therapy should be used carefully when metal implants, staples or jewelry are present on the body because metal conducts heat faster than the body tissue and it may cause burn. So, patient should remove all jewelry before the treatment. If metal is present inside the tissue, mild heat should be used with extra caution and the area must be checked frequently for any sign of burning. Now, along with the benefit of heat therapy, we must also understand some important precautions to avoid complications like burns and fainting. To prevent burns, we should use superficial heating agents such as hot packs or hot water bottles that gradually cool during the application. The initial treatment temperature should be limited and comfortable for the patient. Adequate insulation like towel or cloth layer should always be placed between the heating agent and the skin to protect the tissue. At the same time, the patient comfort must be continuously monitored throughout the treatment procedure. Another possible reaction during the heat therapy is fainting. Some patients may feel faint because heat causes peripheral vasodilatation, which causes lowering of the blood pressure and temporarily reduce the cerebral blood flow. This can be prevented by proper positioning of the patient, proper observation of the patient, and in traditional method it is said that the thalum application over the head or vertex region of the head. So, safe application and monitoring are essential part of the effective heat therapy. Now, Swedan with modern thermotherapy, the basic principle is the same, that is controlled therapeutic application of heat. Acharya Charak has described 13 types of Swed such as Jentak, Ashmagan and Holak Swed. These methods differ mainly in the intensity and depth of heat produced. In modern physiotherapy, this can be related to superficial and deep heating agent. Depending on the type of heat applied, the effect may act mainly on the skin or may reach deeper at the tissue and muscle level. The therapeutic outcome is similar. Heat increases local circulation, it improves the tissue metabolism, it reduces the stiffness and pain, and it causes the relaxation of the muscles. Now, we will see the physiological effect of combined Swedan and heat therapy. Sweating activates the thermoregulatory mechanism which helps in removal of toxins like urea, lactate and salt. Heat application causes vasodilatation which increases the peripheral circulation and relieves stiffness and muscle spasm. It enhances the lymphatic drainage and causes the reduction in edema. Heat stimulates the cutaneous thermoreceptor which increase the endorphin release and thus result in relief in pain. Fermentation reduces the cortisol level and it increases the level of the oxytocin. Thus, it makes the patient cool and calm. Today, modern physiotherapy modalities such as thermotherapy, infrared heat therapy and hydrotherapy because all of these therapies work on similar physiological principles. These therapies produce heat which causes vasodilatation, increase local blood circulation and relax muscle. As a result, pain, stiffness and muscle spasm can be reduced with tissue healing and mobility improvement. Because of this therapeutic effect, they are widely used in conditions like osteoarthritis, sciatica and various types of musculoskeletal disease. Now, coming to the evidence-based research approach over the Swedan therapy. Recent studies on Swedan mainly focus on understanding its scientific effect on the body. Researchers are studying areas such as hemodynamic changes, detoxification markers, pain reductions, outcomes and comparative studies between different types of Swedan therapy and other heat modalities. There is also increasing emphasis on the standardization of the instrument and methods used in Swedan Karma to ensure safety and consistency in the treatment. Overall, scientific research is helping to validate the traditional claims that Swedan improves the circulation, enhances the metabolism and supports the elimination of the toxins from the body. Now, coming to the conclusion. In conclusion, Swedan therapy being one of the Shada Upakram karma which plays an important role in both Purva karma as well as Pradhan karma. It is especially beneficial in Vata and Kapha-janya vyadis where it helps by relieving stiffness, pain and improving the circulation and promoting relaxation. However, to achieve the maximum therapeutic benefit without any adverse effect, Swedan karma must always be performed properly by following the correct procedures, precautions and contraindications. Today, with recent advancement, Swedan therapy is being integrated with modern technology, improved clinical standardization and targeted therapeutic applications while still preserving its classical Ayurvedic principles and concept. Modern research is also supporting its scientific basis by showing effects such as reduction in cortisol, the stress hormone, improvement in circulation, lymphatic drainage, metabolism and detoxification. So, Swedan stands as a good example of how ancient Ayurvedic wisdom is increasingly being validated through modern scientific evidence. Thank you all.